Hey, so this is a young lady who had a subtalar joint dislocation, and her foot was inverted in the dislocated position in Albania, and then she had it reduced in Albania and flew back basically to see me. I had treated her before for something else on the other side. So can't really see the fractures on the plane views, but it's just a little tiny anterior process fracture and then a posteromedial talus fracture, talus body fracture. So in the 3D, you can see the sagittal split right there. And then there's a little comminuted piece that's probably within the deltoid, may or may not be visible. So what I'm trying to figure out, oh, and then here's the anterior process, a little tiny, joint depression on the anterior process, the calcaneal cuboid joint. I was thinking about not doing anything with that. Here's another piece that I think came off of the lateral navicular. Again, maybe treating both of those things non-op. Let me just roll through the axials here. So not a humongous fragment, but also not minuscule, not significantly displaced. So I wonder if it has a chance of healing where it is. And so then I'll go up to the anterior process and the lateral navicular fracture right there. And then on the sagittals, that was the little tiny incarcerated fragment, which maybe that, at the very least has to come out. And then over here to the anterior process, essentially non-displaced, and then the lateral navicular avulsion, little piece in the sinus tarsi. But then I guess I'll come back here to the real question. The biggest question I think is the posteromedial talus body. The reason I'm hesitant to just get in there is because with the posteromedial approach, the artery, I feel like I'm going to have to be retracting against the artery and the nerve, and wondering if it's worth, putting a little tiny plate and screws into here when it's almost non-displaced, and it seems like it doesn't involve a whole lot of the weight-bearing surface. Most of the posterior facet looks fine, and if this healed there, or even maybe if it went on to a non-union, maybe it would still be okay and not symptomatic. Little incarcerated fragment right there, which, her joint probably wouldn't like that. So I don't know, maybe I take that out. Just trying to figure out if you think it's worth it to try to retract that hard against the neurovascular bundle, because I've done these ones that you showed us where we're just, straight, the posterior process, status process fractures, and those ones, it seems like you're looking on them really well, but then way over here medially, am I going to be really retracting against the neurovascular bundle? Or what do you think? Is it worth it to go after that? And then, do I need to do anything with the other fractures, the little anterior process and the little avulsion off of the lateral navicular? Thanks.